This is Ryan Wojciechowski. This is my clinical learning activity for week 4 for catheter insertion. So when we enter the room, we would identify our patient with 2 patient identifiers, so get their name and date of birth. We would assess if they were in any pain or had any allergies that we needed to be aware of. We would place all of our supplies on our clean surface and ensure our patient's privacy here. We would also assess the linens for any incontinence or stool or anything, and then if there was, we would make sure that we changed those before we inserted our catheter here. We would perform our hand hygiene. We have our Foley set up in front of us. We've already removed it from the bag. So when we begin our unwrapping, we'll start with the top. And we'll go side, side, bottom. We want to make sure that we're only touching the outer inch there. And then we're going to slide this around so it's not hanging off the edge and can't come into contact with my scrubs on accident. So now at this point, I'm going to remove our drape here from this end. And it's going to be shiny side down in front of our patient. Want to make sure that we're grabbing this only on the outer inch also to maintain a sterile field in the middle. We want to make sure that we have a gap here in between the two and that they aren't overlapping, since we did touch this outer portion here. So next we're going to move on to applying our sterile gloves. So we're going to take these, move it out of our sterile field, opening it, making sure that we're only touching the outer inch of the folded areas. So our first glove, we're going to grab by our rolled portion here. We're going to move away from our sterile field. We are going to apply it, making sure that we're only touching this rolled portion here. And then we can adjust our fingers after we get the other one on. Since I did make a little rip in the glove there, I would grab a new pair of gloves and apply it here. These are my last pair of gloves that I have. So we're going to use these. And then this portion, we're going to go underneath the rolled part, keeping our thumb away. We're going to move it away from our sterile field, making sure our fingers are tucked down there. Missing a finger here. So now we can adjust our fingers here since these are sterile. Sorry, my sweaty hands don't agree with small gloves. We're only touching the outside here. Making sure we're only touching sterile with sterile. Sorry, I've got to do a lot of adjusting with these gloves. They're a little too small. Alright, so now we've got both of our gloves on. We want to keep them above our waist in order to prevent contamination. Sorry. Alright, so now we're going to remove anything from here that we don't need. So I'm going to take this drape, move it off to the side, drop. I'm also going to take our sample cup here, off to the side, drop. So now I'm going to open our betadine, going to tear it here, place it over the top of our cotton balls for when we clean, move this over, drop. And now at this point, I'm going to adjust this so we can take the top portion out, making sure that we're still within an inch of our sterile field on each side. So at this point, I will take out our lubricant gel, place a little bit here, drop this off to the side, drop the cap off to this side. Then we'll also be grabbing our sterile saline, drop this off to the side, and we're going to insert this into our port, as so. And then we'll also dip our catheter end into our lubricant here. So now that's all set up for insertion. we're going to put this back on top of our tray here. We're going to move this over to our sterile field in front of the patient, making sure that we're within that inch on each side. I'm going to adjust this so you can see. So now we're going to grab our green tongs. I'll use this finger to spread the labia. So this hand's now contaminated. So we're going to grab our first cotton ball. We're going to start on the patient's right side here of the labia. Start at the top, go down to the bottom, around our sterile field, dispose. Then we're going to go on the patient's left, top of the labia, bottom, around our sterile field, dispose. And then now we're going to go down the center, clean that off, bring it around our sterile field, and dispose of it. We're also going to drop our green tongs here too. So now we are going to grab this portion out. We're going to make sure that our catheter syringe is facing towards the patient. We're going to move forward with our insertion now. So we're going to tell the patient to bear down that we're going to insert the catheter now. So we're going to insert the catheter in here. We're going to inch it forward, making sure that our right hand here does not come into contact with the patient in order to prevent contamination and keep sterility. So we're going to go until we see urine. So I see a flash of urine now. I'll go another inch or two. This left hand is going to slide down and clamp right there on the front. So now at this point we are going to insert our saline to fill the balloon. Alright. And then we're going to make sure that we hold this plunger down here. Now we can slide this up, take this port out, and dispose of this off to the side. And then so now at this point, we would attach our catheter here. We would anchor it to our patient's right leg. And then once it's anchored to their right leg, we're going to give them some room around here so that the catheter is they're able to move without pulling on the catheter. We're going to remove the catheter from the box here. We are going to hang it on a portion of the bed on the side. That's an immovable portion that can't go up, down, or turn to the side, so it won't tug on the patient. And so then that would conclude our insertion of our catheter. And so now we would move on to if we had to remove the catheter from our patient. So I would take off these gloves. I would perform hand hygiene. I would grab a new pair of gloves, and I would also grab a clean syringe here. So we're going to place our clean syringe here. This is a clean procedure and is no longer sterile. So what we're going to do is we're going to start with deflating our balloon. So we're going to take our syringe here. First we're going to unhook our catheter from the side of the bed. We're going to empty the catheter out. We're also going to remove the anchor, remove the urine from the bag at the end of the catheter, And we're also going to remove our anchor from the patient's leg. Alright, so we're going to insert this into our port here, and we can put a little napkin below the patient at this point just in case there is any spillage. So we're going to start with removing our fluid from the balloon. So we're going to pull, wait, let it fill, pull, let it fill, pull, let it fill, pull, let it fill. And now that we've seen air bubbles, that is going to be the end of the balloon. So we're going to remove this from the port. We're going to dispose of this off to the side. And at this point, we're going to take our napkin, place it underneath the catheter here, and then we're going to tell the patient to take a deep breath, and then we're going to slide the catheter right out. And then once we're done with that, we're going to dispose of all of our materials in the receptacle bins that are that we follow with our guidelines with the hospital that we're at. And then we would take off our gloves, perform hand hygiene. We would ask the patient if there was anything else that we could do, lower the bed, raise the handrails, put it in the lock position, assess their comfort level, give them the call bell just in case they need anything. Then we would perform our hand hygiene, and we would exit the room and document our what we did today on our patient.